and challenges that we have is really in the Medicaid space. And part of it's multifactorial. When you think of Medicaid, they are all the states are supposed to provide coverage for pregnancy related services for women up to 60 days postpartum. So, when I say 60 days postpartum, that's the first red flag that we have, because we know a lot of the pregnancy related deaths are occurring up to a year. So we definitely want to see expansion of Medicaid beyond the 60 days. But what has occurred is that there's no formal definition of services that have to be covered for women outside of the inpatient and the outpatient hospital care scenario. So that means that across states, there's coverage that is varied and it's not consistent. And it's only those states that have really adopted expansion of Medicaid. So 12 states in particular have not. And so that means that there's a lot of stipulations in place and there's a lot of barriers that still exist for being able to get access to clinical resources for comprehensive coverage for lactation services. And even those states that do provide preventative services, a lot of times those Medicaid plans, they will put extra stipulations like utilization controls or authorization or quantity limits in place. And so with half of the women in the United States giving birth on Medicaid, we know it's probably one of the single greatest things that we could do to expand coverage of breastfeeding services is to create and remove those barriers that Medicaid has to support greater comprehensive coverage of services.